Honourable member for Halifax.
Le niveau de détresse de nos anciens combattants est problématique. Selon l'Ombudsman, le taux de suicide est 45 % plus élevé que dans la population générale. Malgré les signaux d'alarme, le gouvernement se traîne les pieds. Le vérificateur général affirme que le quart des anciens combattants doivent attendre plus de 8 mois avant d'accéder à des soins de santé mentale. C'est inacceptable. Pourquoi le ministre essaie d'économiser $1 milliard sur le dos des anciens combattants?
Thank you, Mr. Speaker. Mr. Speaker, I want to thank the Auditor General for recognizing that Veterans Affairs does indeed have a robust mental health strategy in place, that we have put in place mental health support, that we provide rehabilitation to veterans in a timely manner, and that we're working to improve the consultation process with our veterans. Mr. Speaker, again, it was our government that asked the Auditor General to review our services that we're providing to veterans so we can be better informed and ultimately make the process better, Mr. Speaker.
And the honourable member for Halifax.
Well, speaking of the mental health strategy, in 2009, the government committed to develop performance measures to assess if the mental health strategy was meeting the mental health needs of veterans. And the Auditor General has now confirmed that the minister never followed up on that commitment. He didn't even bother to collect data that would be helpful to make this eventual assessment. So can the minister explain to Canadians why he refused to fulfill this commitment and ensure that veterans receive the mental health services that they need?
The honourable Parliamentary Secretary.
Mr. Speaker, Sunday, our government announced additional mental health support for Canadian Armed Forces personnel, veterans, and their families. We're investing in major new operational stress injury clinic in Halifax, Mr. Speaker. We're also opening new satellite locations across the country while expanding the current facility in the Greater Toronto area. Mr. Speaker, our government is committed towards our veterans, armed forces members, their families, and we will continue to work on their behalf.
Absolutely. And the honourable member for Halifax.
If they're so committed, then they need to actually act, Mr. Speaker. The universality of service rule has been called arbitrary and unfair by the Canadian Forces Ombudsman, yet the Conservatives insist on keeping a policy in place that discriminates against those suffering, it leads to more dismissals, and it robs Canadian Forces members of their pensions. So, given the outcry from members and veterans, will the Conservatives show some sense of compassion, and will they remove universality of service?
The honourable Minister of National Defence.
Mr. Speaker, in fact, the Canadian Armed Forces work with ill and severely injured personnel who are no longer able to serve, and they're provided up to 3 years to prepare for the transition to civilian life. The Armed Forces members can also transfer, if they wish, to cadet organizations, administration and training. I should point out to the honourable member that we've invested nearly $30 billion in delivering benefits, programs and supports. None of this had the support of the opposition, but we will continue to support veterans and members of the armed forces.